Good night, everybody. I think we can start. It's a good moment to do this. So let's go ahead. I think it's enough time expecting for more classmates. So tonight we have our last Monday class. So let's try to finish in our best way. And well, a good point to do this, I think, is to certainly do all the topics we have to complete. So give me a second. Okay, tonight we are going to check again more views, more topics in order to make it properly. Today we are going to talk about the physical examination. I mean how to give some orders, some instructions for changing positions or doing something specifically, okay? Specific questions about mental state examination, some ideas about how to explain in the diagnosis and management, of course, ideas about discussing the treatment with the patient, and how give bad news. Of course, we have protocols of that, but we are going to check as a general view everything about it. And tomorrow in the last workshop, we are going to take in count on a specific acronyms and a specific protocol to give bad news. So let's go ahead. Well, we know about the physical exam. This is the basis of our medical career. I think is one of the most important parts because from these maneuvers, techniques we develop, we have the chance to give a diagnosis. And according to that diagnosis, it's possible to continue our job, giving treatment, following the situation with the patient, what we know about it. All cultures, all doctors all over the world have the same or similar procedures to develop these techniques and maneuvers in order to provide the best control of the patient. We need to touch the body patient in order to know how it's going on. For catching that confidence, we could say, We must remember this, get in mind that it's important to introduce ourselves. When we introduce ourselves, we have the chance to show that we are interested on the patient and we are interested in breaking the ice. Then we could go, we could start explaining or asking for expectations and clear in a simple way what's going on. And best questions to do that are these ones. We can say, do you know what we are going to do this morning? I'm going to examine your, for example, your abdomen, so I can find out what's causing this pain, for example. Another way to ask for what we are going to do today is, what we do is, what happens is that, or maybe I'll ask you to, or are you ready? Okay. All of these questions, those ways are the way to break the ice with the patient and make it easier to touch, to make physical contact with the patient, and in that order, to have the best way to receive or to give the information properly, and to find what's going on without being offensive or annoying to the patient. That's why we have to ask for. We all know, have this in mind, but sometimes because of the rush, we only think that we go talk and take a diagnosis, and it's not possible. We have to touch everything. As much as we touch is better. And if we have time to talk with the patient, is the best. So if the patient know what's going on, if the patient know that we are going to take or to make a physical exam or to develop some maneuvers, it's going to be easier for us and for them to understand the situation completely. And they are so helpful, so cooperative. So there is no way to misunderstood the context and the ideas we need to develop at the moment, or the ideas we have to share with the patient. As a third step, we must instruct the patient in a clear but polite manner, but a polite way. When we give instructions, we are asking for specific activities, we can say, specific movements or specific positions that we are going to check in the next slides. As a fourth step, we must show sensitivity to the patient's needs and respond to discomfort, measuring if appropriate, or reassuring if appropriate. I mean, we can tell the patient that the maneuver could be a little bit helpful or painful, but it's necessary to develop this. We might be so clear in that situation because patients are expecting for us to tell them the truth, of course. We can tell them, you might feel a little bit of discomfort. It's clear, it's polite. We are showing the real situation to the patient. Another way, this might hurt a little, but I'll be quick. Perfect. Another way it works. Tell me if it hurts. That's an expression that I certainly like and that I use a lot. Or another way, let me know if it's sore. The same, right? It will be over very quickly. It won't take too long. Or while doing the process and maneuvers, you are doing very well. We are reassuring the patient that everything is going in a good way. As a fifth step, talk the patient through the procedure. While talking, we distract the mind, and there is no way the patient to try to cheat us or to lie about something. We have to be focused on that we are looking for objective information. A good way to do this is to explain the patient what we are doing, how it is going, what to expect. For example, you could say, I'm just going to, okay, or first aisle, then aisle, or now I'm going to, or then you'll feel, or when it's over, or aisle, that's it, all over. Well, you know, all of these explanations during the procedure. This way is to introduce what we are doing, a good way to catch the attention of the patient, to be alert on the information, knowing their feeling, and it's easily to make. It certainly works with children and some teenagers. They think that checking the procedure, talking about it while we are doing this is a good way, and they feel better. They don't feel scared. You can reach confidence easily. The sixth step, share your findings with the patient. While finishing, you must talk to the patient, or to, if there's a children, to parents. And you can tell them, well, I'm fairly certain you've got a, or you could say, one possibility is it could be what we call, and then give the diagnosis. Or a good way to give this information, I have not found anything to suggest any problems. Sometimes it happens, right? So let's consider this. There are just suggestions. If you have another way to do this procedure, or to give the same information or the same introduction to this information, of course, it's valid. It's a good way to work on. Giving instructions, well, that's perfect. We were talking about it in the previous slides. And giving instructions is very important in our career, in our activities daily, right? When examining a patient, polite forms are often used to for the initial instructions. I mean, there are some expressions that because of the auxiliary of the verb are so polite, you can use them. For example, could you bend forward as far as you can? Or if you could cross your arms in front of your chest. Or what I'd like to do is examine your standing up. So you can see the way, the expression we use, so polite. So we decide when to use these expressions, because some people, when you're talking that way, they certainly misunderstood. I don't know why, maybe because of the cultural way of thinking, but it happens. You can give in another way a direct instructions. Some examples: stand with your feet together, or lie perfectly still. I mean, you're just giving the instruction without the connector of the word, of the connector of the verb. Okay, just you start with the verb, you know, general English, and it's easy to make. You are going to the point, you are not rounding, so it's easy to make. Or for making soften an instruction, get them into a question. For example, can you just turn to the side again? Could you just lie on the couch? So you can see that way of asking for make us easily to check what's going on, right? So it's, in my opinion, a good way to do this without any trouble. We have this chart with our blue guy. Well, you might watch this into the homework. There are lots of instructions. Please study them, check them, because from these instructions, I'm gonna take some of them to the final test. You guys bend down, breathe in and breathe out, close your eyes, curl up, do this, and the patient has to copy the movement you are developing. Put your head down, put out your tongue, raise your leg, roll onto your back or front, roll over, roll up your sleeve, sit or sit up, slide your hand down your side, for example. And with a picture is easy to understand, easy to make it. It's a piece of cake, of course. We have more. Follow my fingertip with your eyes. You can see how the lady is following the fingertip of the doctor. Then keep your knee straight, of course. Let your wrist go floppy, you know. Lie on your side or lie on your back. Lie on the bed or lie on the couch. Lie down. Look straight ahead. Look at something. Look at in front of there. Look at that. So we have ways to give this instruction. Slip off your coat. Stand straight. Stand up. Take off your top things. Tilt your head back. Touch your shoulder with your shin. So give these instructions. Then we have some more. Open your mouth. Point to the finger that moves. Pull as hard as you can. Push as hard as you can. Turn your head to the left. Turn on your side. Or other instructions. Relax. Show me what movements you can manage. Tell me if it hurts. So you can see all of these instructions are for make easily our physical examination, and of course looking for a specific objective during the evaluation. With this movement, we can evaluate lots of things we all know. About the mental state examination, well, we have in Module 1 a class about what was specifically about psychiatrics. We were talking about some disorders, and now it's like a complement of that slides. So let's check this. Some symptoms of psychiatric disorders are the next: delusion, dementia, disorientation, hallucinations, illusions, obsessional symptoms. They're just the most common. Of course, we can make a long, very long list, but it's not objective at this point. For example, a delusion is a firmly held belief which is wrong but not open to argument. For example, a deluded patient may not accept that his psychiatrist is in fact a psychiatrist. Or dementia is significant mental deterioration due to physical changes in the brain. The disorientation is mental confusion about time, place, or identity. Hallucinations are apparently normal perceptions which happen without the appropriate stimulus. Any of the senses can be involved, especially vision and hearing. For example, like hearing voices, or by watching bugs going through the walls. They are the most common hallucinations. Illusions are misinterpretations of real stimuli, or obsessional symptoms are stereotyped ideas or impulses which the patient cannot resist. They include obsessional thoughts and obsessional rituals. So considering all of this information, we have the chance to identify or to make the definition about mood. But talking about mood, it's not easy, of course, because patients can use lots of ways to give the same expression or idea about the mood. Lots of words. That's why, as an example, I bring this to you about anxiety and depression. About anxiety, they could say, I feel restless, I've been feeling anxious, worried, wound up, panicky, frightened, tense, agitated. All of them are synonyms of anxiety, so take them in count. They are important. They are nowadays one of the most common situations in our patients. While talking about depression, ways to express this feeling, this mood, could be low, sad, depressed, dejected, unhappy, or miserable. So patients could use different ways to express the same idea. Patients could use any of these expressions in order to show the mood. So let's consider this. The most common way is like this one in the bubble. I've been feeling, and then the specific expression, okay? Well, we have more expressions. Patients may also use the following adjectives to describe their condition. I mean, confused, angry, embarrassed, muddled. For example, I get very confused about time. I can't remember what day it is. People make me angry. They are so irritating. So we are checking synonyms, right? I'm too embarrassed by my appearance to go out. I stay at home. It's so hard. Or another way, I get muddled when I'm shopping. I go out for milk and I come back with cheese. So checking this, it's easy to catch the synonym and easy to understand what they are talking about as a general idea, right? A very good way to describe how we certainly feel is to use this chart. Very useful in my opinion, very easy to use. Patients understand it and they can place the situation without any trouble from the beginning. We got the mood meter. How are you feeling? It needs an extra word. How are you feeling today? So following the colors, following the definitions we have in each box, we can help the patient to establish how the mood is at the moment, helping them to identify the energy level and the feeling that they are having at the moment, if that's negative or so positive. So checking this, we are checking the color, we are checking everything, and then we can place just one characteristic in each color, or well, in the colors that they feel that something is going on. So typical questions for mental state examination for making this evaluation are these ones on the list. The ones that I found, well, the most common and most important are these ones. Can you describe your mood at the moment? How long have you been feeling like this? Do you take pleasure in anything? How are your energy levels? What's your appetite like? Have you noticed any change in your weight? How are you sleeping? Can you keep your mind on things? What do you feel the future holds for you? Have you ever felt that you don't want to go on? Oh, so hard. Have you ever thought of suicide? So direct. When you give that kind of very specific and direct questions, usually patient says, no, how you might think on this? And then we have to take this into account. They are not telling you the truth. Talking about explaining diagnosis and treatment. What did I do? Well, we have to take this in account. I'm sorry. An idea get out of my mind at the moment. I'm sorry. Well, let's consider this. This is a protocol, a procedure we follow all the time. And we have some steps to take in account in order to give the information properly. In that order, we must consider that the final part of a consultation is an explanation. In that explanation, we have to talk about the diagnosis, the management. Patients, of course, have the right to know what is going on, but we are responsible to show how they might understand or how they might get this information. That's why we must remember that the identification of the disease from its signs and symptoms is very, very, very important. But certainly nowadays we really need the support for not doing everything by clinics. Some expressions we can use to give this explanation are the next. You are suffering from, and then we give the diagnosis. You've developed. That is why you have, or this is blah, blah, because blah, blah. So you have the chance to give this information. You have the chance to give all of these details in order the patient needs to know this, and with them, it's possible to get in the best way, in the best confidence, and solve the situation as we can do. While finishing talking about the diagnosis, we must talk to the management plan. During the management plan, we include investigations and treatment. Okay. For example, I'll make an appointment with the X-ray technician, could be. Or I'm going to start you on medication too. So when we comment that the patient needs a specific drug to go over and forget this specific question, that's the way we can do this. So we can say, I'm going to have you admitted to, I mean the patient is getting into the hospital, maybe to a specific service or in specific branch, or I'll arrange for you to go to nutrition, for example. You'll be given and then just explain medication, or they may advise I expect you'll have. So take these expressions in count for having a specific way to get it, a specific way to start talking with the patient. When we talk about changes in lifestyle, well, we consider again specific ways to introduce this sentence, because sometimes it's not, this information is not well attended by the patient, it's not well received because they don't want to change, and it's their right. But we have to consider this. We can say the nurse will give you advice on okay, I'm sorry. Okay. Expressions that are important about talking in changes in lifestyle are the next. The nurse will give you advice on, or you should try to give up. I want you to, it's important that you, so you know, just advices. We are not giving orders, giving directions, giving specific ideas how to start this situations on. While talking about prognosis, it's not easy. We have to consider that what is likely to happen. So lots of these situations to give a prognosis is because we have all the elements in order to take them in count. It's better to tell them the truth instead of saying something that couldn't be truth, but we have to make it easier. It's not possible. It's not the way we must work. So we can say, I expect the treatment will, or hopefully we can never be absolutely certain about, because we never have the 100% of anything sure. I mean, in medicine, we all know that nothing is 2 + 2, 4. We know in medicine is completely different. You should remain optimistic. Well, it's not so easy to give this expression. When we arrive on the question time, that's the situation we were talking in the previous slides. We give the patient the opportunity to ask as much as the patient wants and to show us the knowledge they got about it. And we have the opportunity to help someone staying home. Okay. So some specific questions could be, do you have any questions? Is there anything you'd like to ask? In that way, patients may feel in confidence and they might give us this kind of expressions, or they might ask anything they want. Sometimes because of the shock of the news in the way they are, they don't feel so good asking at the beginning, and during the process, during the treatment, they make lots of questions. We have to be patient and take into account that it's not an easy situation, right? We're using lay terms. When we use lay terms, I mean, we use the jargons, the ganjas, in order to make the patient understand the explanations. I mean, we give the patients the option to be ourselves. We are the ones who need to understand and to reach the way of talking with her. I mean, it's not easy, right? It's not easy to exchange our technical explanation into social English or very basic English, but it's a talent we are going to improve during the time. Some medical conditions with the Lloyd terms are the next one in this chart. We got the blue guy. So practice on them, check on them carefully because it's going to be a test. And for example, for emeremesis, the patient late term could say vomiting blood. Another way, nocturia, for example, needing to pass urine at night could be. Well, as you know, we can say the patient, tell me, what about your insomnia? Some of them might understand, but it's better to say, what about with troubles while sleeping? It's easier. You're feeling confidence and it's possible to work on this. When we talk about medication, well, for example, for medical conditions, medical situations, we can say, for example, antidepressants, and the light term for them, tablets to improve your mood. We all know that's the objective of this medication. Or maybe hypnotics. It could be understood as sleeping tablets, okay? So let's take it in count. For oral contraceptives, easy, the pill, the most common, I think, the best way to understand this idea, universal way to talk about it. While talking to patients again, we must exchange our medical definitions into simple definitions. We must exchange into the way they might understand this explanation. So, taking into account the knowledge they got, the studies, I mean, if they finished just high school or primary school, or if they reached the university programs, we have the chance, or we have the opportunity to talk with many different people. So following the simple definition of the medical term, it will be easier. Okay. Let's go ahead. Well, this is an example just for reading, for catching the vocabulary and practicing how to give an explanation. We have the explanation for an angina. So read this at home, take it in count, and consider that it's important to find a way to do it. When we discuss a treatment in medicine, in medical branches, I mean, we all have we all understand that we don't make a support on this. We give the medication, we give the instructions, and patients may decide the way they want to talk about it. But we have to talk about it at the beginning, previously giving to the patient in order to work properly. So we have the chance to offer options. If we got this opportunity, it's better to do that. But we all know that sometimes it's not possible to do it. Some expressions that would help us to give these options we are the same. For example, there are a couple of options we can use. The first option is to try tablets like Prozac that lift you up a bit. The other option is counseling. So take this in count. We have the chance to discuss, to get in touch, to listen to the patient, to listen to its fears, and we can make a better job. Let's go ahead. Advising a course of action is focused about these expressions specifically. Some time of work might help. I mean, we can advise our patient in changes in lifestyle in order to improve their health. Or maybe we can advise in order to continue taking medication, or in the way to receive food, maybe, or to prepare food, but everything with an objective medication. We have to consider this, that when we advise, the patient is the one that is taking the last decision. If the patient is taking the last decision, it's possible to receive a no for answer, or maybe we have to get patients to take a deep breath and then explain why the patient has to do it again in a different context. Possible to make? Of course it is. And well, for example, you could say, if you still have some pain, you can keep taking paracetamol. So let's take on this. Some specific words or specific verbs to help us are keep talking, carry on. So let's read these bubbles, okay? About avoiding something, we have some new expressions. For example, could add, and we advise the patient in order to improve. So I think it's not an objective to give an order at this moment, but we have the chance to continue ahead and then make it properly. While talking about warnings, we must consider all the explanations, all the alerts we give to the patient in order to come back, or maybe avoid medication and run to another hospital. We try to prepare the patient to be alert into the possible situations that are going to happen. So, for example, you can say it's very important you don't stop taking your tablets. Okay, or another way. If you keep damaging it, if you keep damaging it, you are going to end up with a long-term problem. So there are just expressions, just words to give these warnings, to talk about the problem and then the consequence. About giving bad news, as I was telling you, there are lots of protocols and lots of ways to do this. So we must follow some steps in order to make it properly and not reach high levels of stress while giving this explanation. But we have to continue in order. We have to be so clear on these steps. We have to show that we are certainly clear on this and following the steps we have already taken. We must consider that the information you give about bad news, the patient and relatives are going to remember this all of their lives. So we can give warning. Maybe we can say it. The principles of giving bad news are the next. They give warning, to choose an appropriate setting. And in that appropriate setting, you have to take in account a friend, relative, or someone who the patient trusts on. We must take time. We use appropriate language. So it's not easy to give a bad news, but we have to go ahead. We have this responsibility in this. All of the bad situations, all of them by experience, have at least one positive point, maybe different or a difficult one to recognize at the moment. But when it makes possible, please, we have to get back in that way. We discuss treatment again. And then, while discussing the prognosis, we have the chance to show that we certainly know what we are talking about and how is this procedure going on. We might supplement the verbal message. I'd like to record this consultation so you can listen again. It's because about the range of follow-up sessions, it's better to give the worst part at the beginning or the second appointment. And then the fourth, or the last step is to confirm that the patient understands everything. I mean, when we confirm if the patient understood, well, it's our moment to ask for about it. In that way, we know if the patient is clear and understood all the explanation, this step is going to be so easy and the patient is going to feel better about it. In all of the bubbles, you have a suggestion how to make these questions, how to reach this moment. This report is just for sending you specific vocabulary in black and words. Please read all of this. Consider that at this moment the patient is vulnerable and you have the key to make this hard situation easy to understand and to pass away and continue. So don't forget, don't stop when you are tired, stop when you are done. Giving this information, these expressions, it's not easy at the beginning. You certainly need practice, certainly need time. Sometimes it's a good exercise to talk in front of the mirror, and according to that, it's possible to organize all the ideas we must get in mind in order to make a good job and talk properly. So considering all of this, we have to take in account how to express these ideas, how to show all of these ideas. Let me send you the poll to take attendance, okay? While the attendance is going to be filled, I'm gonna upload the slide. Oh no, you got the slides. Can you all watch the poll? Let me see. Yes. Actually, the slides, I sent them the last week during the, well, for doing homework. So it's possible to make it right. So you got the presentation in previous weeks. Oh, in last week, I mean. So if you fill the pool, if you all could watch the pool, that's done, that's all, and we can meet tomorrow during the last workshop. Some extra information, well, as you know, this Thursday is going to be the final test about Model 2. Keep on reading, please. Any question you got, please send me a private message and then we can solve this. And, well, patience. I'm going to prepare all the scores during this week in order to get your final score ready on Friday after the test. Okay, if you fill the pool, we can leave and let's meet tomorrow. Okay. Okay, it's done. In order it's done, we are going to finish this.